Assalamu alaikum, this is Shamama and today now we are going to start our lectures on potassium and what they do, how the whole mechanics of potassium occurs. But today it's just a brief video on the relation of potassium and diabetic ketoacidosis. So yes, it is very important that what will happen in a patient of DKA, that is diabetic ketoacidosis, and what will be the effect of its potassium levels. So without wasting a minute, let's just start our video. I've made a small illustrations here that imagine this is a cell and this is interior of the cell, intracellular compartment, which is rich in potassium as we know it before. Fine, and this is a blood vessel that because of diabetic ketoacidosis there is increased molecules of glucose in the blood. So what is happening that if in this patient this potassium sitting in the cell as an observer, it looks with this, I've made these goggles or you can say the binoculars. By it the potassium is seen in the cell and looking that what is happening in the blood. There is some mess there or there is something very interesting going on, because now some new molecules are present within the blood. So what this potassium do is it moves out of the cell just to look that what kind of circus or what mess is being created in the blood vessel, just to look at it. Has that curiosity that okay, let me just check what is happening. So what will happen, this potassium along with many other molecules, it will start to move out of the cell into the vessels. So this potassium will then start to enter in the vessels. Fine, and that is why a patient having DKA will start to have hyperkalemia unless the insulin is not administered and it is not treated. So a patient of DKA will have hyperglycemia. This is a very common question asked from you and a concept that you mostly get confused at, so it's very important. Listen carefully, do listen it till the end. Now what will happen, this potassium has come out of our cells, which is meant to be within the cells, and is now in the blood vessels. There is hyperkalemia, and we know hyperkalemia is not too good, it's very bad, it causes very damaging effects to the body. So now what we do is, and DK is itself life threatening, so what we do is we administer insulin to that patient as a treatment measure, of course. Now what will that insulin do is that, just see this insulin, it has these two big hands with it. This is the insulin molecule with these two big hands. Now what does this insulin do? It will start to pick up the glucose and put it into the cells, so that blood glucose level start to decrease. What does this insulin do? It does with his big hands, it start to pick up the glucose and start to put it inside the cells. Fine, so now these glucose molecules, now it's not just one cell, I've just for explanation purpose made a single cell. There'll be a lot of cells around, like all those cells that utilize glucose for the energy, and the insulin start to dump the cells with the glucose in the cells. Now when the glucose will start to enter the cells, this potassium is left behind. So potassium sees that okay, the circus or the play that I came to see in the blood vessel is now ended. It has now come to its normal level. So potassium says okay, I have nothing to do out, and this potassium, it then also start to enter back into the cells. Potassium will start to enter back into the cells. This potassium coming back into cells. Now we have to take care that if we are giving insulin to the patient, we have to manage the dose of the insulin to avoid hypokalemia to develop, because of course it is also not good and it is life threatening. It can cause very serious damage to the body. Now I think it's clear that what does insulin does. Insulin puts this potassium along with the glucose back into the cells. So it brings basically the calcium, the potassium and the glucose levels back to normal. But we have to take caution that hypokalemia doesn't develop, because that is very dangerous. So this is the point that you have to take care of. So this was the whole discussion, that what is the effect of potassium levels in a patient of diabetic ketoacidosis, and why during its management or during insulin administration potassium move back into the cells. Now very important clinical correlate here too is that if the patient is having if we have administered increased level of insulin to the patient, then what will happen is that hypokalemia can develop. Fine. So this basic concept will help you a lot in understanding the whole clinical correlates as we go for studying hypokalemia and hyperkalemic states. So thank you very much. I hope you liked the video. If you do so, please like, share and subscribe, and I'll again request, please share it to all your fellows, so that max people can avail the benefit. It will be a big favor for me. Thank you so much. Allah Hafiz. See you in the next video.